Hello, Tucson. This is Rob Tatum with Tucson Wellness MD, founder of Tucson Wellness MD. And today we have Dr. Miner, our specialist in sports medicine, regenerative medicine. And we have Doug Rainey, who's an expert in peptide therapy and cellular tissue. So we are here to give you guys some information on what's going on today with the procedure we're doing and kind of give you a look into advanced healthcare coming to Southern Arizona.
You know, I had, if you don't mind, Rob, I want to give you guys a little bit of credit here. So I moved to the area about 2 years ago. My company, Athletic Integrative Medicine, has been in this space for close to 15 years. You know, started in surgery. We did a lot of sports medicine. I was with Johnson & Johnson, big bad J&J forever ago. We've done wound care. We've done everything in the integrative space you can possibly imagine. Believe it or not, I actually did medical aesthetics. You couldn't tell. But, you know, I moved here and I met you guys almost immediately because you're on the way to the gym. So every day I passed this spot. So I, stopped in, said hi, met Gary eventually. I've had nothing but amazing experiences with Dr. Miner. He's an absolute wizard with ultrasound. It's just rare. And this is what I want everybody to know out of the gate. It's rare to see a group like yours, and not just in Southern Arizona, in general, that has a comprehensive understanding of every single aspect of the process, from intake all the way to application, having access to all of the right products, knowing how they work, which, believe it or not, is not all that common. And then having a specialist like Dr. Miner that can actually apply this stuff correctly. So I was very excited when I finally met you guys. And the fact that I'm 8 minutes down the road is truly a blessing for me. So
it has taken, Tucson Wellness right around 5 years to assemble the comprehensive team that works together. Because a lot of times when I was searching for the right team, egos got in the way, heavily. Whereas our team now just incorporates all those modalities: medical nutrition, science, evolution genetics, sports medicine, regenerative medicine, Eastern medicine is a big component, and then even aesthetics, how you look, how you feel. And a lot of times it was laughed at with this approach. And now that we're just in 3 locations in Southern Arizona, because like you said, the distance, some people want care, but they don't want to drive 30, 45 minutes. So opening up on the northwest side, having our east side location, being out south, going to Marana coming up, and just really, we consider ourselves the future of healthcare. Yeah. But to be the future of healthcare, you have to have the most innovative stuff, but you also have the most high quality stuff. And then partner with you in getting some lab grade and not that compounds are bad, but compounds have to do their own due diligence regulations, whereas the lab is already just highly regulated and you using only U.S. product sources. Yep. We're just really excited to be in this space with you and glad to be working as partners.
We, you and I clearly share a lot of the same ideologies here, because you're right, 100% USA, API, everything done here. Almost every raw is from the United States. The only aspect that simply is not available here are raw aminos, but they're from only FDA approved facilities. Everything's, properly registered. And then of course, as it's manufactured here, all of the testing, everything start to finish is done in-house. So you're right, very different from a compound pharmacy. And again, not to speak negatively at all, they're extremely necessary. In fact, they're some of our clients, so we still work with them as well. But I really appreciate what you said about assembling the right team. And you're right, I shouldn't just speak about Dr. Miner. You guys clearly have taken the next step in building this business. Since I moved here, you've already opened multiple new locations. So obviously you're doing a lot of things right. All of the groups that I've worked with have told me something very similar, that, you can start with a great idea. You can have the best of intentions. You can have a really great demographic, et cetera, et cetera. You don't get to that next level without the right people. So Tucson Wellness definitely has the right people in place. As I mentioned, I've had nothing but great experiences here. I feel like the bedside manner that you guys promote gives people not just a great result, but a great experience. Some of these procedures are not cheap, and there's a reason for that, but you are going to come here and have a great experience. So I want to take this opportunity, if it's all right with you guys, I want to learn more about Dr. Miner, because you and I have hung out a bunch. You've stuck me with a bunch of needles and I haven't felt anything, which is unbelievable. Yeah. But I'd love to know more about your background. And, if you don't mind, tell everybody kind of what's your specialty? Where did you start and how did you get so interested in what you're doing today?
Certainly. Absolutely. So I am Dr. John Miner. I have an athletic background myself. Grew up as a swimmer, soccer player, water polo player. Always dreamed of going to medical school. I was going to follow my dad's footsteps and go into orthopedics. It was not until the middle of my fourth year of medical school that I realized I did not like the lifestyle of a surgeon, and I needed something other than just living in the hospital and worrying about the next time I was going to be on call and what was going to come in that was giving me anxiety. But as an athlete myself, I was always interested in sports medicine, orthopedics, and fortunately had an opportunity to do a rotation in non-op sports medicine during my fourth year of medical school. So
Where?
So I was at Texas A&M University.
Nice. Okay.
And
Very cool.
I did a rotation at the University of Colorado, 2 weeks right at the very end of my fourth year.
Boulder?
Yeah, so University of Colorado.
I was a buff as well.
Awesome.
How about
Yeah.
that? For about a year until I
Yeah.
ran out of money. But all right, I
I
love that
spent
school.
about 6 months in the Denver area, my fourth year of medical school,
Nice.
and that I was not really aware that there was a non-operative orthopedics route at all, and so I was completely turned on to it. Realized, oh wow, there's this really cool tool, ultrasound. A lot of people are starting to use it, and I knew that was something that was going to separate me if I could really learn how to use it appropriately. So I actually wound up, the only decision I needed to make was, what am I going to do my residency in, and then go on and do my sports medicine fellowship. So I loved pediatrics as a third year rotation, and when I pulled out of going the operative route, pediatrics was what I figured if I wound up not doing ortho, I could see myself as a pediatrician. So
Cool.
I did that, which is one of 5 routes that you can go into, and then go into non-operative sports medicine.
Okay.
So I wound up doing my pediatric rotation or my pediatric residency, and then I spent 2 years in Boston. I went to Boston Children's Hospital for my sports medicine fellowship. I think going back to a little bit of you mentioning, man, I have felt nothing when you poke me with a needle. I take a lot of pride, and I think it's some of the pediatric background of trying to do no harm and not scare people and educate people and have a very light touch with the needle as well. And so I think that has helped.
Yeah.
And the sports medicine fellowship is 1 year long, and then I wound up spending an extra year. I was the first ultrasound fellow at Boston Children's who got to spend an extra year at Boston Children's, spending 2 days a week working exclusively with the ultrasound docs, and 2 days a week doing my own sports medicine clinic as well. So I got lots of hands-on experience, really starting to delve into some of the regenerative medicine, lots of PRP, seeing very tough cases as well.
Yeah, I think one aspect that we loved about Dr. Miner's his patience with the clients. We treat wellness, not really sickness. And we do have some clients that have had strokes or survivorship for cancer. We do go that far, but finding a doctor that's willing to sit down with the client for an hour was really hard. So we were trying to just find that person that actually cared, because he does all this advanced stuff, but he also cares about people who are just doing general care, like losing weight, just feeling better on day-to-day basis. It doesn't have to be the most complex thing, but he also takes as much time with a client that most people would dismiss quickly, especially in the MD field. And I'd say about 20% of our clients come in just tired of like standard care. Nobody pays attention to them. Dr. Meyer told the other day, the average time a doctor spends with the patient is 7 minutes, 5 to 10, around 7 minute average, where our consults are an hour. And it just shows a lot to the character of our team, with Dr. Meyer leading the way, saying that, hey, I'm going to spend this time with the person, even if it's something as gentle or as basic as losing weight or just trying to feel better, sleeping, sleep problems, stress, that a lot of people would just dismiss. And it's not just the skill set and the education and the precision, because he's so thorough. We've all been injected by Dr. Meyer numerous times. I've had my back, knees, we've had people with headaches been injected, but just taking the time even on a basic care level that I think it's been lost. I harp this on our team. We're all about culture. Culture's first, right? Culture, people, numbers. That's kind of our motto. And just harping on the team that the traditional ways of healthcare have been lost. They have been ruined by corporate money, shareholders, and it's tough for them to get out of the space where I think smaller businesses like ours are trying to lead the way. And like you said, you have to have the team. We call it the squad. We don't call it team. We call it our squad members. And you have to have the knowledge, right? You have to have the education, and you have to have the product. Like you cannot treat people without those things. And we see lots of places lacking somewhere in there or cutting corners. And like you said, you're a cash pay. We take HSA. That's about it. But the value is there. And every time clients come in, it's the value you're paying. The products don't actually cost as much in the overhead, especially with our partnership, because we don't have the middleman, and that's why we're able to give people these services that are far more affordable than anywhere else. Well, I would say in Arizona for sure. I can't speak for California or the other places, but
I can.
Yeah. And people say, and we try to tell them, it's because of partnerships. When you make good alliances with people that we're treating, because you are a client as well as a partner now. Big Gary, our powerlifting champion, same thing. He was a client. Now he does our business development. A lot of those people are functional medicine doctor. He was also, I treated him with amino acid therapy like 15 years ago. Now he helps us out. Like those things are important. But we always struggle to find the quality product. Like you said, U.S. source is just next level stuff, but also the attention to care.
Yeah.
What do you think about that, Doug?
I just feel like you and I have aligned so well on so many different topics. And it sounds really cliche, but the moral and ethical commitment to one's community and understanding that, look, if you really do want to expand nationally, globally, it starts here first. Right. And I know I said it already, but the fact that I live right down the road and I've got you guys to not just support what we do, but reciprocally, we both feel like these communities are reasonably underserved for the most part. Mm-hmm. And I don't mean that from a demographic standpoint. I literally mean, you said a second ago, the average doctor spends 7 minutes with a patient. I have actually a completely different statistic that within 30 seconds, a PCP typically is prescribing a drug. It happens that fast. Now, they usually have seen someone else first, right? They've got some sort of didactic beforehand, but that's a statistic we've had in other companies I've worked for in the past. It is a function of healthcare in this country. It's just the way that, probably coming after me for saying it, but Big Pharma they have their hand in everything. Insurance is in cahoots with them. We all are starting to see how that works. A lot of people have been more exposed to that reality since COVID. The interconnectivity between government agencies and the way that healthcare is actually provided in this country. So, and I'm not saying we're the worst. We certainly are no longer the best though. And so the true understanding of integrative medicine really is having all of those different vantage points that you mentioned, having a squad of individuals who bring something unique to the table so that anyone that comes into the door is handled correctly. It's not that here's our menu, we're going to find a way to squeeze you into it, the circle into the square, whatever that saying is. That's not the way that you guys function. And that is the design of healthcare in the country, sadly. So I think that's a really unique model, and it's something it's part of the purpose for this podcast. We want to make sure that people understand what they have access to right here in their hometown, not needing to travel internationally, going to a third world country, right? Yeah. Doing all the shady stuff you see on Instagram and sorry, Instagram, I'm probably on Instagram, right?
Well, they try to come and educate us on how someone else is doing. Like, we don't want their technique, but I wanted to touch really quick with Dr. Miner, coming into a field like this. What does it mean to you to have more time to spend with the client on all levels? Like I said, even your general care, because we get clients who try to run in the door and talk to them real fast, to get some quick advice. But people don't understand is we have concierge clinicians. So when you come into Tucson Wellness, you basically get a assigned nurse is your concierge clinician, and that's the person that guides you through your health journey, whatever it is. They have access to myself, Dr. Kellens, Dr. Miner, Monique, my sister who does concierge medicine. They have access to these people, and it's nice as having your clinician can say, hey, let me just ask Dr. Miner real quick what's going on here. Maybe I can help you out faster. But what does that mean, Dr. Miner, to you? Because, most people get in healthcare to take care of people. It's not for the money, that's for sure. Like every doctor, every nurse I've ever met has said, I'm here to help people. But they can't do it because they're restricted so much now. What does it mean to you to be able to have that time and work with the clientele we have?
To me, it means everything. To be able to have that time. I mean, even whether it's a client who's trying to just catch me between visits or a nurse who comes in, I like being able to take the time to go back, look at the big picture, look at the labs. What did we miss? Is there something else going on? And when you actually have the time to care, you can provide so much better care. And even the 45 to 60 minute visits that we have for a lot of our musculoskeletal patients, I need a history, and I want to review things, and I need to be able to do a physical exam. And if there's a reason to put the ultrasound on them and take a look, it gives me time to do all of those, and then to provide some education as well. And you can't do that in 7 minutes. You can't do that in 15 minutes. You need time. And so without a doubt, we provide care, we provide service, and our clients are very well taken care of for that.
Again, I think that's what's lost in it all, is that timed care. We have a part of our model is human element, right? And the importance of actually paying attention to the person and their needs. And I think when you have a database like in Dr. Miner's head, if you just, sometimes those minute details only are heard after longer conversations as people become more relaxed, that the short time would not allow someone to kind of voice. And when you have someone, again, we get a lot of advice from people that look at Google and come tell us these things, but that's not the same as having like experience, and that's what I try when I travel. That's what I do when I look at the site. Like I'm traveling the world trying to get input from people from all kinds of medical fields, and even basic fields, nutrition or even agriculture sometimes, or ecologists, just traveling the world trying to bring it back. And then I can run it through Dr. Miner so he can go, yeah, that might be good, that might not be good. But he's also open-minded to not being defensive when you come back and say, hey, this is what they're doing over in Germany. What do you think? Because most people, I don't do it Germany. This is me. Yeah. It's not like that. Our team is just very adaptable and flexible to something new. And we throw out about 99% of things that are just nonsense, but the few that make it through, highly effective. Like, we have our products we use from you. There's not that many. Yeah. We have one today we're going to take called GI Modulator, which is really the advanced reducing inflammation, helping the gut quickly, before we do some of this other push infusion here. But those things are advanced care. I'm not kidding. I always tell people we're the beginning. And, we were laughed at when we had one room. 7 years ago, Tucson Wellness had one room. Then 2 years later, we had 4 rooms. 1 year after that, we had 7 rooms. 1 year after that, we have 12 rooms. Now with this one, we have 17 rooms, and we'll have 20 coming up. But the patience for it, not rushing, finding that team, because that's hard. There are a lot of people that, they're just kind of droning through day to day, but it's just imperative now that we have all the components, man, that we are excited. We never did podcasts before. We were just growing so fast. We really wanted to put our feet down, and that's where we're at now. Our feet are down. We have the team. We have, even the guy filming all this, man, big ups to Miguel here. He's also a client of ours. Been with us a long time, volunteered his time to help us out because he believes in it. Big Gary, who's a 5-time gold medalist, going for his 6th coming up. He was the client, started working for us. That's how we built the team, as product of product, people coming in, seeing the results and going, hey man, there's our position here. We even have 58 nurses apply our last position. This is the future of healthcare, man. I think people are seeing it, and we can only step on ourselves right now.
I mean, you continue to go down this path of further explaining how integrative you guys are, bringing information and education from around the world, open-mindedness from even other practitioners, right? We're also, not to kind of on parallel paths, if you will, from the representative and manufacturing side. We're also trying to do more of these types of events because we need everyone in the integrative space to get back to the way it was pre-COVID, where we're all sharing information. Mm-hmm. That's the way it should be. Like right now, there's still this almost compartmentalization of, we had the isolation aspect of those, year and a half, maybe the 3 years if you're in California, right, where people just stopped associating with one another. And it's so weird. You go to these conferences and people are so excited to be back together and learn from each other. Hey, what have you been doing the last couple of years? What did I miss? What types of prep methods can we use to make these treatments more effective? What types of conditions are you looking for? What drug interactions are you concerned about? You can go down the line of, we're like hammering this home, but the downside of the way that medicine is currently structured in this country compared to what this relatively small percentage of the population is focusing on. And I think, again, that's the basis of why we're doing this today, is to make sure that everyone here understands that Tucson Wellness and the small percentage of groups like Tucson Wellness are genuinely focused on integrating all different types of medicine, making sure that we're not just going for prescriptions and surgeries. Of course, they're still necessary. Yeah. There are scenarios where they're appropriate. I sadly am one to have had spine surgery myself, but these types of procedures have drastically helped me recover. Mm-hmm. So it's not just about avoiding surgeries. There are scenarios where you'll have to do that. There are scenarios where certain conditions will have to be treated with pharmacokinetics. But we can hopefully reduce the side effects. We can hopefully get you off of those types of meds, especially if they're dangerous long term.
Improve outcome, prevent resurgery, reconstruction.
Well, that's the importance of Dr. Miner as well, is you still need someone who oversees that. You still need a medical doctor. I'm not talking about provider. You need a medical doctor. You need an MD. Yep. Okay, so that's the oversight you're always going to need. And that's a critical component that I think some people are cutting corners on. And then, my sister, she was a lead physician at Banner in Phoenix. Now she's a concierge doctor. And then my concierge doctor is Doug Little. You need that MD level of care to oversee that. And that's important for us because I just do the science portion. So I'm coming with ideas that don't make any sense. I don't understand, don't make sense medically, but that's why it's governed, like how to regulate myself too. Because, as a scientist, I'm thinking innovation, and then data. I've got 1,098 files on record that I've shared with Dr. Miner and our director, Kayla, that are encrypted for all the research we've done, all the reading, and our longevity product, our idea came around 2016. We started researching that, me and Dr. Kellam's like, that's how long it takes. 2016, we implemented about 2 years ago, but it took years to actually bring that to the forefront and then to get white papered and published. But those are the critical components of what's going on. Real quick, so Kayla's going to come put this stuff in our bags, but Doug, why don't you introduce what we're doing here, because you're the expert in this field.
Yeah, this is kind of the meat and potatoes of our discussion today, huh? Yeah. So we got some Myers cocktail in the bag just as a nice introduction to the system. So for those of you that are not familiar, it's a good kind of vitamin mineral mixture. Really great for hydration purposes. It can help with cramping. I mean, it can help with a million different things. You're going to feel awesome the rest of the day regardless. It's great for brain health. We will then be combining a mesenchymal stem cell isolated exosome product, and I'll talk a little bit more about what that is, with a live stem cell product, also mesenchymal stem cell. These are coming from birth tissue allografts. Of course, all of these things are, FDA regulated. We've got all sorts of data regarding the safety profiles, information on the donors, et cetera. So no concerns for disease transmission, but these are not what you would consider to be autologous. So obviously none of us have done bone marrow aspiration or adipose draws. These are products that are going to have a tremendous effect long term. So we in this room are very fortunate to be mostly healthy. right? So this is going to be very much an anti-aging, super longevity, heal up some of my injuries, right? Oftentimes this level of procedure could be used for any sort of high level neurodegenerative condition, all the way to, I mean, we even, believe it or not, there's a lot, you mentioned pediatrics. Autism is a very commonly treated condition these days with these types of products. Systemic inflammatory conditions of all kinds. Lyme's disease is a very common topic these days. A lot of our partners who are using things like ozone therapy are doing these synergistic treatments. I believe that's actually something you guys have here as well, right? You do some ozone therapy.
That is correct. Yep.
So again, that whole idea of integrative medicine, understanding first and foremost, who is it that we're working with? What conditions are they focused on? So we'll call that the anticipated clinical endpoint. And then also, what comorbid factors are we having to compound in advance of actually creating a care continuum? And again, to your point, it's why someone like Dr. Miner, with such a great understanding of holistic medicine, you know, literally head to toe, and then of course every potential drug interaction, all of the potential side effect profiles. Safety is always first, right? But these products are going to be, I think, as time goes on, as data continues to be shared publicly, everyone's going to realize this is arguably the most effective and safest when you put those on maybe like an XY axis.
Dr. Meyer, tell us, you know, from your experience, like, you know, kind of educate us on how that's going.
Yeah. So, I mean, I think too, starting from the very beginning, planning these procedures, understanding what is what we're infusing, what we're injecting, where we're going, how the science works of exosomes and stem cell, and where they're going. So we can put wonderful product into somebody's body, exosomes, stem cell, and it is going to attack the places that need to be hit first. So planning is everything. So if somebody's health is off, they have poor kidney function, liver function, we may have a little bit of work to do before we actually go through. I mean, they're going to spend thousands of dollars to do a procedure like this. So let's make sure that it's working for them, set their body up for success. And many times we have to stage this. And so if from my perspective, we're seeing wonderful success by prepping, doing blood work in cases where people may not be as healthy as we would want them to be, and planning that. We have our comprehensive team working with our biokinetics coach who, after we have performed the procedure, we're trying to set them again up for success. We're invested in their success. So we look at their flexibility, their side-to-side symmetry. How do they walk? What asymmetries do they have in strength? So that when we inject their hip, their knee, somewhere else, we want to make sure that the compensation that they've been doing for years because of that injury or problem, we're actually overcoming that so that we get long-term effects. And really, we have seen some wonderful results to this point, and people are committed to it as well.
It's kind of sad to say, you just can't do it basic anymore. You know, diet and exercise and sleep are three of our main components here, right? Stress is one we're adding as one of those main factors, but you cannot combat all the stuff that the environment's throwing at you now. And this isn't an ecology speech or nothing, but it's a fact that these chickens and these cows, they are pumped full of all kinds of stuff to make them bigger, to supply more food and make it more profitable, and everything, your greens. So we have to counter all those things. And again, so when someone comes in for regenerative med, we've got to make sure their body isn't toxic before doing that. I don't think a lot of practices never talk about the toxicity of someone's body before trying to fix them. They don't want to touch it because they're afraid to run off a client. Where we're like, no, we're going to do this right, because our reputation is Southern Arizona, and we're keeping it small and local for a reason, for the care.
I can speak to that on the manufacturing side. So our version is endotoxin. Endotoxins are highly inflammatory. They're very dangerous, and especially if you're going to be infusing something, right? If you have a product that has a reasonable endotoxin level and you're doing small, consistent sub-Q injections of it or intramuscular or something, it may not be as big of a deal. If you're going to take that entire bottle and you're going to infuse it intravenously, right? You better know what's in there. You better know. So we've talked about this a lot actually at the lab, because they have I should know this, ISO 17025 is their certification. It's the highest level government certification where they can actually trump other third-party independent testing. So they do third-party themselves for others as part of their business, but they also will be able to trump anyone else's third party. That's how highly certified they are to do their training, their testing rather. So we always brag about this. Our NAD is so insanely low from an endotoxin unit standpoint. USP, United States Pharmacopoeia, basically actually an independent group whose main job is, well, I shouldn't say main, they have a lot of jobs, but in this particular instance, they are defining sterility. Let's just leave it at that. So USP 797 is a sterility profile. They allow 0.5 endotoxin units per ml. That's the general allowable from USP. Our NAD tests at 0.000567. We are 3 magnitudes below what they allow. Extremely important. Now, the other thing that we test is our water. So we start by testing, it's in Los Angeles, so we start by testing city water, 1.6. Yeah. So you would never, ever, ever want to infuse. Not that anyone does that, right? But you just, so let that sink in for a second. City water is at least 3-fold over what the USP allowable infusible level of endotoxin unit is. That's scary. That's a big city too. That's a lot of people.
Well, that's why the water, again, that's why the water is what it is. And I think people, in my field of research, you go to those densely populated cities, typically you see that. Now, there's some countries who have it down, where the environment is clean, like Tokyo, Singapore. Those places are spotless despite the population density. So some people do have it down, but when you're doing those kind of water sources, and again, drinking water is critical, right? And it's something that I had a bunch of people call me this summer saying, I'm feeling tired. Should I come in? And always we ask them, hey, are you drinking water? Are you getting sleep? No, neither of those. We'll try that first before you come spend money with us. That's a basic, right? Hey, hydration and sleep. Are you those two? And not come in, we'll fix it. And so a lot of them, I had to drink more water, or I just need to add a little bit of salt. We were big on just put a little salt on the tongue with the water, right? You need balance. People don't understand that salt is critical for hydration. They think it's opposite, but those are, for your cellular balance, that's necessary.
Ion channels.
That's it. Yeah, no one knows what ion channel is, but hydration, right? So when you're just talking to a client, like, need a little salt and some water, you should be good. And then they don't have to come in. But the first response thing to people, especially in America, are, I feel bad. Who can see me? Who can fix it? When the solution's usually simple.
Must be a pill.
Yeah. Must be a pill.
Where did that come from, though? That's interesting. No, I think this is such a fun conversation. I feel like we could go on and on and on about this. If you want, the last thing that I'll contribute, unless you have any other questions, you mentioned GI modulator. Do you want me to go into that just a little bit? Yeah,
so we're going to drink. We all have it here, so let's just see what we're drinking. It's not a 5-hour energy. It's
not. It's about the same size, though. It tastes a little worse. Yeah. It's not that bad, but it's berberine. So the berberine in there does not taste great. It's going to give you a funky little sour taste for about 20 seconds. But quercetin, resveratrol, berberine, all plant-based, lots of antioxidants, lots of anti-inflammatories. Then there's also KPV and BPC, both of which are gut-based peptides naturally. So of course, synthesized in the lab, but they're naturally occurring. Then we also added thymolin and thymosin alpha-1. Very much, again, I will also say certainly anti-inflammatory, but very immune boosting. Right. So the idea with this, as you can imagine, it's designed for high-level gut issues. So things like Crohn's, IBD, you could even throw in some other systemic inflammatory conditions there, potentially things like rheumatoid arthritis, Lyme's it would be great for. But our rationale for making this is we actually have a bunch of family members that have all sorts of issues with digestion. And that's probably not even fair. It's way worse than that. But I mean, you can imagine combining Crohn's and IBD in a single individual is extremely painful. And it's very detrimental for day-to-day life. So for our purposes, again, as reasonably healthy guys that probably eat way too much protein, it's very useful for us too. It's going to help balance flora. It's actually able to even reconstruct some of the gut lining. But you can imagine some of the biologics that these patients have been put on for years and years based on these systemic conditions are very detrimental. Don't even get me started on Humira, right? Like we have talked about that. Enbrel and Humira, these TNF blockers are, you do not want to have that in your system forever. Right. So we're trying to come up with something that's much more natural, much more repeatable. This would be something that for someone in that acute stage, you take it every day for a month, kind of get yourself on track, get to a maintenance phase, just like we talk about with everything else we do. I will do this kind of the same way that I'll do like Epitalon, do it maybe twice a year, 10 bottle cycle over the course of a month. So I'll do it every third day rather than every day. Gotcha. Luckily, knock on wood, I don't have the same issues I used to have. But H. pylori was a huge problem for me. I was diagnosed about 15 years ago. Acid reflux constantly, especially when I was eating pizza. You know, God forbid we go out and watch some football, drink some beer, eat some wings, right? You know, exactly. Yeah. Dude, I was a mess for days after that. It was awful. I couldn't lay down. You know, I had to stand up when I was drinking. Right. It was just terrible. So this has been a godsend for me, but even more so for some of our family members. So,
and just touch up, you know, one thing we're critical about supplements in the industry. I guess, Doug, you know better than anyone, like just kind of touch up on, you know, when people say something like, well, this is more expensive than buying some probiotics from Walmart or Costco. Touch on the differences between this quality grade product compared to like the supplement industry. And I'm not trying to bash supplement industry. We're just trying to kind of promote what we're doing. We're not here to talk trash about anybody else.
For sure. I managed a vitamin shop about 20 years ago. So I know a lot of the inside scoop there. And I'm with you. There's a lot of great over-the-counter options. And a lot of times they are great adjuncts. Most of the time when you are in a critical scenario, it's just not going to be enough. Typically, purity's not there. The transport mechanism is not there. So how about this? Rather than talk negatively about what I've seen in that industry, I'll tell you why this one is so unique. And it's not even just this one. We use this technology with a lot of our products. I won't get too into the science and bore everybody listening here, but there is an inclusion complex that we use that actually is FDA approved. It is a non-glycemic sugar. Don't worry about the name, it's super annoying. Basically, it's a version of cyclodextrin. So what that means is by encapsulating these molecules, you can first and foremost combine all this stuff together. A lot of people in the peptide industry will tell you, oh, this is impossible. You can't have all of those peptides in the same fluid. Most people will tell you can't even inject them in the same syringe. Well, if you properly encapsulate them, you can. Then they're not going to interact. You don't have to worry about potential cross-linking. Again, just as a reminder for those listening, peptides are basically just single amino acids linked together by hydrogen bonds into a specific structure. That's how they're defined. And so if that structure breaks apart, think of it like Jenga. You know, so you've got these hydrogen bonds keeping the Jenga tower together. As soon as it falls down, you got a bunch of wood pieces, you have a bunch of amino acids, that's fine. But amino acid soup isn't recognized as anything. Right. It's not a signal. The body does not respond to it in any particular manner. So the CD, the cyclodextrin that we use to encapsulate each of these, first and foremost, allows them to properly coexist. It also greatly extends the half-life in the body. It creates hepatic bypass, so it's great for the liver. And then on top of that, it makes it orally bioavailable. So we're going to drink this. This is not normal. Usually you don't have hardly any ability to get proper absorption from these things orally. It's almost as effective as IVing it. Now, nice. The other advantage, because we want it into the gut, we'd rather not IV it. Because where does everything go? Venous return, heart and lungs. So we want to orally get this into the gut as fast as we can. That CD helps us go through first pass metabolism as well. So the esophagus isn't destroying everything like it usually does.
All right, cool. So I don't know how to drink this. We need some kind of...
No, so I already had my...
Chase it?
Yeah, no, it's not, honestly, it's not that bad. I was giving you a hard time. It's really not that bad. So just pop everything off and then down the hatch. Yeah, I think I really oversold it. It's like the aftertaste, it's sour, right?
Yeah, not terrible.
You want one, Gary?
You ready to drink yours? Oh, it just popped off on its own.
Yeah.
You can't wait for me to drink it.
Yeah, it's nice and easy.
Have some of me.
No choice now.
Mm-hmm.
Yeah, so I love this idea as something that we could use.
Hold on, I'm going to stop you real quick, Doug.
Yeah.
For all of us who are athletes, this doesn't taste that bad.
No.
But I'm guarantee you, if you're a person that cries about the taste of something that's healthy, you're going to complain. Right? Because all of us grew up in the protein days where it was like chunky powder, but you just chugged it. Now it tastes like chocolate milkshakes.
Mm-hmm. It's true.
Fine for me.
Yeah.
But my ex-brother-in-law was Mr. San Antonio. And he used to say, I don't eat for the taste, bro. That's what he always told me. So when we'd be eating something bland, and he was Mr. San Antonio, he was jacked to the gills, and he worked hard. But, he taught me early, hey, man, performance eating is not pleasure eating. And if you're going to be an athlete, if you're going to excel at anything, this goes back to our clients. If you come to Tucson Wellness and you have a goal, we are going to steer you on the right path. That might not be the path we'll make it simple for you.
Yeah.
We'll simplify the approach, but it won't be easy. And if it comes down to drinking, powders that don't taste great, or, it kind of tastes like, I don't know, a better version of Robitussin in a sense. I don't know, it tastes like, now I haven't had Robitussin in 30 years. I'm just guessing what I remember. But it's just good to touch on this point. When you come to us, we will put you on the right path. Again, we'll simplify it. That doesn't mean it's easier. You're trying to look like Doug, or you're trying to lift as much weight as Big Gary over here. If you're trying to run a Ironman triathlon like Dr. Miner, we'll help you get there. It just won't be easy. And sometimes recovery is not easy either. It really depends on the path. I think when people come in, because of that expert group we have, we will steer you in the right direction. We can shift through all the nonsense that's on social media, because they're just trying to get views. Where we have been offered sponsorships. Dr. Martin's been offered a place to train people. We have turned down every single company that comes to try to get our name on that brand, because we are not going to be compromised. And anytime you take money from a company, right? You take money, it's unavoidable. Now, I'm not saying they're harming anyone, but if you're sponsored by a green powder or protein company, you'll say, this is the one I use. This is the one I use. But that doesn't mean it's the best one. So you're not really lying to the person. You are, this is the one you use, but there might be a better product out there. And Dr. Myers had tons of opportunity to train people in our area, and he refuses to do it. I've had companies call me trying to partner or put their brand on something. There's just no way, because first of all, we don't need you. I think that's my favorite line is, you need me more, I need you. And we're in that position. We can do that now. And it's a very good position, because all of us are just happy to be in the field. And that it's just important to know that, sometimes drinking something like this, I'm stoked. When I saw the vial for the first time, I've seen it obviously on our list, we can get it, but I am, thank you, Doug, for bringing this. For sure. Super stoked. Thank you, Dr. Meyer, for approving all the care we get, and being open-minded, because without you, none of this is possible. And thanks for Big Gary for setting all this up. And of course, Miguel, thank you for your, when they see this, they're going to say, man, who did all that recording? So we're going to give you the kudos you deserve as well. And this is all possible. Again, all these connections came organically. All these connections came from what I call the flow. You guys know I'm very spiritual like that. This is the flow. This is putting us on a path to do better. And we're just excited to bring this to Southern Arizona. At Tucson, I'm a Tucson native. This is Tucson Care. And we're going to start here in Tucson. We're going to, what we call, perfect it. But we're going to keep on learning. I'm going to keep traveling. I've got some travels coming up here. South Africa is next on the list. We're going to keep on bringing what's advanced. So Doug will keep on bringing us the latest, greatest, most effective product. Dr. Miner will still be running the medical care behind us, making sure everyone's safe and it's effective. I'll keep bugging everyone to death, because I call everyone every day, our whole team. I call Natalie, our manager, Kayla, our director, Gary, every day. I'm yelling at him about something like, come on, Gary, you got to do this. We got to get on it. I was arguing with Doug last night. I bugged Dr. Miner to death. And I'm just so grateful for everyone having the patience to deal with my impulse, but it wouldn't happen without everyone here. And I'm very humbled and fortunate to be here. I want to thank everyone for being in here.